I'm Benjamin Davis. I am a hip and knee reconstruction specialist. I work in Asheville, Arden, and the Hendersonville areas. I do clinics in Brevard as well as Haywood. My surgeries are performed both in the hospital and outpatient surgery center setting. So, total knee replacements have been a successful surgery for a long time. They've done pretty well. However, all of our literature shows that we could do better. There's a percentage of people that are just unsatisfied with the total knee. Robotic surgery utilizes the latest technology and a robotic arm, which helps make the surgeon be more precise for the plan they have for the knee replacement. The robot does not perform the surgery. I perform the surgery using the robot as a tool. We're able to control the robot the entire time, but what it does is it allows us to execute the plan with perfect precision. Key advantages of robotic knee replacements are that each patient is different. And so instead of hoping that the way we do the knee replacement works from person A to B and so on, a robotic knee allows us to customize the plan to the patient. The robotic technology allows us to adjust the position of the implants, whether it's the angle or the flexion of the implants, to the 1/2 millimeter and 1/2 degree. What this means in the long run is implants that last longer, but more importantly, it's a more natural feeling knee, which means patients are able to get back to their activities quicker, perform better, and overall have a better experience with that knee replacement. Evidence shows with robotic knee replacements that patients are more satisfied with their knee and they have better function and motion, which is crucial in recovery after a knee replacement. We're also seeing that robotic knees have more precise implant placement. What that means is we're able to develop a plan, or we're able to decide on a plan that's best for that patient and execute that plan with perfect precision. And so that means a longer lasting implant, a longer lasting knee that hopefully doesn't require any more surgeries. With robotic surgery, we sometimes will utilize preoperative imaging, whether that's radiographs or a CT scan, and then intraoperatively in the surgery, there's no difference in the incision itself, but what we do use is special sensors and a computer navigation system. These sensors allow us to stress the knee in extension and then in flexion, and we're able to determine to the millimeter how much tension is in those spaces. That then allows us to adjust our plan. Once a plan is made that is personalized to that person on the table having the surgery, we're able to execute that plan and position the implants to optimize how the knee feels, how the range of motion is, which means a better recovery after surgery. Anyone can benefit from a robotic knee replacement, as this allows a quicker return to function and a better experience with the total knee. Robotic knees are especially good for complex knee deformities, which require even more planning, and this allows us to execute that plan with more precision. In the future, we will see robotic knee replacements being more and more common, to the point where all knee replacements may, for the most part, use some form of robotic technology. It's important to find a surgeon who is both well-trained initially with the joint replacement, but is up to date on these techniques and is adjusting and advancing with the times, because I do think we'll continue making improvements utilizing this technology and hopefully just continue to have improvements in patient outcomes and satisfaction overall. Robotic knee replacement surgery improves the accuracy and precision of the surgery itself. This leads to a quicker recovery and longer lasting implants, and hopefully an overall more satisfied patient. At EmergeOrtho, we're able to provide some of the highest quality care at the lowest cost. We have a large group of fellowship-trained surgeons that are able to provide the latest technologies and techniques, and we're able to do this in environments that don't rely on hospitals, but rather are physician-owned surgery centers, which keep the costs reasonable while still providing top-tiered care.